Hi, my name is Hannah Freshour, and this is my head to Toe Competency for Nursing 207. This is my subject, Robert. He is over 18. Robert, are you okay with us posting your video online?
Yes.
Okay, perfect. Okay, so we'll go ahead and begin. Hi, my name is Hannah. I'm going to be your student nurse for the day. I'm going to be doing a head to toe competency on you. Can I see your wristband, please?
Sure.
Alright, and what's your name?
Robert G. Freshour.
Okay, and date of birth?
August 26th, 2001.
Okay. And I'm going to do hand hygiene, safety check. Whenever I'm doing the head to toe, I'm just going to listen to you a little bit and ask you some questions, okay? Just a full body assessment, pretty much.
Okay.
So beds lowered and locked, side rails up, call lights within reach, personal items within reach. Do you like to go by Robert, or do you have a nickname?
I go by Bobby.
You go by Bobby? Okay. I'm just going to write down some notes, okay?
Okay.
Okay, and where are you at right now, Bobby?
Oatman Hospital.
Oatman Hospital. And why are you here?
My back's been hurting me.
Your back's been hurting? Okay. And can you tell me who the president is?
Donald Trump.
Donald Trump? Okay. Alright, good. Okay, and your back hurts. What happened?
I've been doing some heavy lifting, and about 2 weeks ago, my back started to hurt really bad, just on one occasion.
Okay, what were you doing?
I was carrying some heavy stuff.
Okay, alright. So does anything make your pain worse or better?
Getting up and sitting down.
Getting up and sitting down?
Yeah.
Okay. And have you been taking anything for your pain?
Tylenol.
Tylenol? Okay. And how much Tylenol have you been taking? Do you know off the top of your head?
Not a lot.
Not a lot. Okay. And how would you describe the pain?
Kind of a dull pain. Just in my lower back, kind of isolated.
Dull. Kind of like a sore aching almost?
Yeah.
Okay. And it's in your lower back. Is it isolated? Or does it radiate?
It's kind of isolated.
Okay. And what would you rate it?
7, maybe.
7? Okay.
Yeah.
And does anything make it worse or better? Or, I mean, like any time of the day, I guess is what I mean, in the morning or night?
Evening, right before I go to bed.
Right before bed, it feels better?
Yeah.
Okay, and is this affecting your day-to-day life?
Not really, just getting up and sitting down.
Yeah, it's just more of a nuisance than anything?
Yeah.
Okay, alright. So, I would get your height and weight, but we do not have a scale or a measurement thing, so I would, if we had those equipments, I would do it in the metric system. So I'm gonna get your vital signs. Do you have a preference in arm?
Right arm.
Right arm. I'm going to do a 2-step on him. Just relax your arm for me.
Okay.
Okay, so about 100. There's just going to be a little bit of a squeezing sensation. Okay. 98/66, that is good. Okay, I'm going to go ahead and do the heart rate next. Do you have a preference in what wrist I do?
No.
Nope. Okay. temperature. I'm just gonna put this underneath your tongue, okay? Alright, 98.3. Feels good, that's normal. Okay, and I'm gonna get your oxygen saturation. Can I see your finger, please?
Sure.
Alright, your O2 is 97, that's good. Okay, and he doesn't need orthostatic vital signs, but if I were to get them, what I would do is I would have him in the laying position, then I would put him in the sitting position, and I would get him in the standing position. Each 3 positions, I would wait 3 minutes in between, in which each position I would get his blood pressure and pulse. Okay, so I'm gonna go ahead and start with your head. So I would don gloves and do hand hygiene before and after, but I don't have any gloves, so I'm just going to examine the head for any lumps or bulges, any skin breakdown, any infestations. Hair looks good. I'm just gonna feel your head. Have you had any pain or anything?
No.
No? Okay. No facial pain?
No.
Feels good. Temporal arteries are good. Go ahead and open and close your mouth. Got a little bit of popping. Is that normal?
Yeah.
Yeah, okay. Clench your teeth. Okay. And go ahead and puff out your cheeks. Smile. And frown for me. Alright, looks good. Okay. And then I just need to feel your sinuses. Does this hurt at all?
No.
No. Okay. And does this hurt?
No.
No. Actually, you use your thumbs. Okay. All right. So I'm gonna go ahead and examine your eyes.
Okay.
If you can just follow my pen light, okay? Alright. 6 cardinal fields look good. And can you look straight into my pen light? Alright, light reflex looks good. Okay, and just watch it. Okay, and then look straight at me. Pearl is present, looks good. Have you had any eye pain, anything, any itchiness, any problems with your eyes?
No.
No, okay. Sclera looks good. Can you look up for me? Alright, conjunctiva looks good. So everything is good there. I can just if I can move my pen. Okay. So I'm gonna go ahead and examine your ears. I'm just gonna look at the outer structures. Make sure there's nothing abnormal. Looks good. No skin breakdown as well. Just gonna look at your other ear. Okay, looks good. Okay, if you can go ahead and stand up for me, we're just going to conduct a whisper test. This is just a test of your hearing. Do you feel like your hearing is okay?
Yeah.
Yeah, okay. So what you're going to do is you're going to take a finger and you're just going to cover the tragus right here and just kind of make a circular motion so it's like opening and closing that a little bit. and I'm just going to say some letters, numbers, words in your other ear, and I'm going to say 4 of them, and whenever I'm done, I want you to tell me what I said, okay?
Okay. A. 7. B. C.
Alright, we're going to do that one more time. Same ear.
A. 7. 12. 3.
Alright, good. And I'm just going to have you do the same thing with your other ear, okay?
Okay. 5. 4. 2. 1.
Okay, good. So go ahead and sit down for me. So in your right ear you did miss a letter, but that's okay. You're able to correctly tell me after the second attempt, so that's fine. Give me 1 second. Okay. So now I'm just going to examine your nose. Have you had any trouble breathing or anything? No? Okay. Just looking at it. Looks symmetrical. Looks good. Just going to look up your nostrils. Looks good. So what I'm going to have you do is just cover one of your nostrils and go ahead and breathe. Are you able to breathe okay? Okay, and then other nose, nostril. Okay, and what I'm going to have you do now is close your eyes and I'm going to have you smell something and I want you to tell me what it is, okay?
Okay. Vanilla.
Yes. Alright, looks good. Okay. So now I'm going to look in your mouth. I don't have a tongue depressor, so what I'm going to use is the thermometer. So open up. Say ah. Alright, and I'm just looking at your hard palate, soft palate, gums. Your tongue's nice beefy red, which is good. And I would be wearing gloves for this as well, and I would do hand hygiene before and after, but again, I don't have any gloves. I'm just going to look at your teeth. Looks good. Okay. Go ah. Gag reflex is good. Sorry.
It's okay.
And then stick out your tongue. Okay. Looks good. Do you have any trouble swallowing ever? No. And I'm just going to look at your tonsils. Alright. They look normal. Good. Okay. I'm just going to examine your neck now. Carotid arteries are good. Okay. I want you to push up. Okay, good. And move your head side to side. Okay. Okay, now we're going to move on to your thoracic. So if you could just go ahead and lay flat for me, or actually you can stay sitting. I'm going to listen to your lungs first. So I'll do the 8 on the front and then the 10 on the back to listen to the lungs. Take a deep breath every time I move my stethoscope, okay? And typically you would go underneath the patient's shirt or have them remove their shirt, but for privacy reasons we are gonna keep his shirt on. Okay, go ahead and lean forward for me. I'm gonna do your back. Same thing, if you could just take a deep breath every time I move my stethoscope. Okay. Okay, so lungs sound good. No crackles, no wheezing, no strainers, nothing like that. Okay, now I'm going to go ahead and examine your heart. So, again, I would take off his shirt or go underneath his shirt, but for privacy reasons, we're not going to do that. Actually, what I'm going to have you do is I'm going to have you lay down for this, okay? And the apical heart rate was 79, which is good. Similar to his radial. And then the heart sounded good as well. No abnormalities there. So while I have you laying down, I'm going to examine his abdomen. Typically, I would lift up the shirt to look more, but again, for privacy reasons, I'm not. When I would lift up the shirt, I'd be looking to see if there's any bruising, lumps, bumps, anything like that. So, and I would also note the warmness of his skin, and if there's any edema present as well. Same thing with the chest. Doing that, so then I'm going to go ahead and listen. So in his bowel sounds in his 4 quadrants, starting the right lower quadrant. Sounds good. And I would also examine his belly button as well. Make sure there is no abnormalities within that, but again, I cannot. So then I'm going to go ahead and palpate. I want you to tell me if you feel any tenderness or anything like that, okay? And I'm going to feel if there's any lumps as well. Any no pain or anything? Okay. And I cannot feel his bladder, so it's not full, which is good. When was your last bowel movement?
A couple hours ago.
A couple hours ago, okay. So you typically go every day or every other day?
Every day.
Okay, no problems there?
No.
And do you have any burning with your peeing? Is your urination okay? Do you pee? How often do you pee?
A few times a day.
A few times a day. How many?
3 or 4 times a day.
Okay. And whenever you pee, is it you have a hard time starting or stopping the stream, or does it stop in between sometimes, or does it flow normally?
It flows normally.
Okay. Good. And if he was a female, I'd ask about last menstrual cycle, and then the female problems, past pregnancies, anything like that. Okay, and can you go ahead and sit up? Actually, we can go ahead. Well, I'll go ahead and do your arms first if you want to sit up for me. So can you put your arms straight out for me, please?
Like this.
Yep, perfect. I'm just feeling if there's any lumps or bruises. I'm checking skin warmth. Make sure it's all good. Abnormalities. If he had an IV or anything like that, I would examine that now, which he doesn't. Brachial pulses are good. Radial pulses are good. Just looking at his fingertips. He does bite his fingernails, I notice. Your hands look good. No bumps or scratches or anything like that. I'm just going to check your cap refill. Skin is a little bit moist, and then I'm going to check your turgor. Good. Good. Okay, so I want you to push down on my hands. Okay, push up, and squeeze my fingers. Good. Okay. Okay, and then I'll have you go lay back down again actually, and I'm going to examine your legs. Alright, hair's equal. Do you have any pain in your legs? It's just mostly in your back?
Yeah.
Okay. Alright, looks good. Checking the pop ladles. Alright, those are good. Okay. Temporal is good. Dorsal pedis is good. I'm going to check the cap refill on his toes. Push. Push up. Okay. Alright, looks good. Okay, I'm just going to do some range of motion. Go ahead and lift it up. Down. Go ahead and bend it for me. Bend your knee in. Alright, good. Same thing, up. Down. Bend it in. Any pain? No? Okay. Go ahead and sit back up. And I'm actually going to check the range of motion on your arms as well. I forgot to look. Up. Down. Bend it. Alright. And then just kind of do a circular motion with your shoulder. Alright. And then other arm. Up. Down. Out. Circular. Good. Okay. Alright, looks good. And I had forgot to mention, I was checking the skin as I was going along with his face, neck, back, heart, everything. Without everything else, I was checking this temperature with the back of my hand. I didn't verbalize that, however. Everything felt good. No edema was present. So, everything looks good. I noticed his gait and his transfer was good. Whenever he walked in, he walks normally. He has no assistance, no assistive devices. So with your back, I just recommend to continue taking the Tylenol as normal, and maybe try some ice and see if that would help. And just make sure whenever you're bending, for future reference, to bend at the knees, not bend over with your back like that. Okay.
Okay.
All right, we're good. And then I would do another safety check. Beds locked, lowered, and locked, lowered. Side rails up. Colleagues within reach. Personal items within reach. Do you need anything else?
No, I should be good.
Nope. All right, and then hand hygiene, and I'm done.